Hello guys, welcome to DAMS-eMedicoz presents The Battle of Sexes, the Valentine Day special quiz.
So let the Cupid's challenge begin. In this, you will be randomly paired with an opponent of opposite gender, and you can tell the subject of your choice, and your opponent will ask the question for that subject. And after that, your opponent will tell you the same, and process continues. For each correct answer, you will be awarded 1 point, and for each wrong answer, you won't be awarded with any. So let the Cupid's challenge begin. Hi guys, welcome to the Battle of Sexes by DAMS-eMedicoz on the event of Valentine's Day. And today we have Team A, in which there is Dr. Adit versus Dr. Gunjan. That is him versus her. And are you ready for the battle?
Yes.
Yes.
So let the Cupid's challenge begin.
Yeah, this is the Battle of Sexes, the Team A, Dr. Adit Jain, and Team A, Dr. Gunjan Motlani. Now you start with your quiz, asking your questions.
So first subject I would choose would be obstetrics and gynecology.
I will start with my first question. Dilute vessel Piper genome test is done for which condition?
It's antiphospholipid antibody syndrome, APLA syndrome in pregnancy.
Yes, that's correct. Then you can ask me from ENT. Go with ENT.
So my question is, Wagner and Grossman theory is related to which nerve? Shall I give you the options as well?
Can you repeat, please?
Wagner and Grossman theory is related to which nerve?
Please, option.
Yeah. First option is facial palsy, 7th nerve. Second option, vocal cord palsy, recurrent laryngeal nerve. Third option, vocal cord palsy, superior laryngeal nerve. And fourth option is 9th nerve palsy or glossopharyngeal nerve palsy.
And what's your question?
Question was, Wagner and Grossman theory is related to which nerve?
I think it's related to vocal cord palsy.
Actually, your connection was lost. Can you repeat?
I think it is related to vocal cord palsy.
So there you have to choose the option. There are two options with vocal cord palsy.
It is with a superior laryngeal nerve.
So your option is vocal cord palsy with superior laryngeal nerve, right?
Yes.
Sorry, that's the wrong answer. It's vocal cord palsy with recurrent laryngeal nerve.
Oh, okay.
No problem. Basically, I'll tell you the explanation if you want. Can I tell the explanation? So basically,
Yes.
I am sorry, answer was wrong. The answer was vocal cord palsy with recurrent laryngeal nerve. Hello.
Okay.
Because only one muscle is supplied by superior laryngeal nerve, that is cricothyroid. Rest all the muscles are supplied by recurrent laryngeal nerve. So basically Wagner and Grossman theory is related to muscle paralysis of the laryngeal muscles which are supplied by recurrent laryngeal nerve. So that was the answer.
Okay.
I would choose the subject as radiology.
It's very easy question. Which scan is used for parathyroid adenoma?
Is the system SPECT scan used for parathyroid adenoma for localizing the lesion of parathyroid?
Yes, absolutely correct.
System PET SPECT.
Yes, correct.
Thank you. So your next subject will be ophthalmology. Okay. Just a second.
Hello.
Ophthalmology. It's actually a clinical question, so it will take a time. You just take time and listen. Okay, I will repeat also. So this is a clinical question. A 11-year-old boy with left hypotropia in primary position of gaze is associated with marked restriction of elevation in adduction, adduction, and a positive force duction test. Right?
Okay.
Visual acuity in right eye is 6/24 and counting fingers in left eye.
Lesion is in left side.
Yeah. Basically, 11-year-old boy presented with left side hypotropia in primary position of gaze with associated marked restriction of elevation in adduction, Basically, he has a restriction in adduction, in elevating the eye in adduction position, and he has a positive force duction test on the left side as well. On visual acuity testing, he has 6/24 in right eye and counting fingers close to face in left eye.
Okay.
So basically, what's the diagnosis and muscle involved? Shall I give you the options as well?
Like lesion. First, I need to understand this question. First, lesion in left eye, which is
Yes,
hypertrophia.
lesion is in the
And,
left eye. Yes,
okay, and force adduction test is positive for which eye?
left eye. Force duction test for left eye.
Okay, and what is a vision for the left eye?
Vision in the left eye is finger counting close to face.
Okay. Okay, please give me your options.
Yeah. So first option is congenital myasthenia syndrome with involvement of superior rectus muscle. This is the first option. Second
Okay.
option is Brown syndrome with involvement of superior oblique muscle. Third option is congenital myasthenia syndrome with superior oblique muscle. And fourth option is Brown syndrome with superior rectus muscle.
Okay, please give me a second.
Yeah. You can write also options if you want. I can repeat.
First is congenital myasthenia syndrome.
Yes.
Second is Brown syndrome, right?
Brown syndrome.
Ah,
Basically, they have options. There are only two syndromes in four options, but muscles are
muscles are
they
superior
have a
rectus
different
and superior
combination with
oblique.
muscle. Yeah.
I think it's congenital myasthenia syndrome, but quite confused about muscle.
So which option shall I take?
Is it superior oblique with congenital myasthenia syndrome?
So your answer is option A, congenital myasthenia option C, congenital myasthenia syndrome with superior oblique muscle.
I am correct,
Sorry,
right?
that's wrong. It's Brown syndrome with superior oblique muscle.
Okay.
Because
No.
in congenital myasthenia syndrome, the child should have ptosis, which in this question is not there. So, anyways, you will have to rule out congenital myasthenia because there is no mention of ptosis. And basically, force duction test is positive. That means there is no nerve palsy. In congenital myasthenia
Yes,
syndrome, there is a nerve
yes.
palsy. So that's why I made. Basically,
No problem.
you can have to rule out
Good
questions to
question.
get to
Good
the.
question. It's really
Thank
very
you.
good
Thank
question.
So, guys, let me tell you the score. It is 2 points for Dr. Adit and 0 for Dr. Gunjan. So, her team needs to gear up a little. Okay? So, let's carry on with the third question.
My last subject would be dermatology.
Do you know about Minky Kinky disease? Can I ask you from that?
Yes, you can ask.
Okay. What is what is the gene effect in that disease? Also the enzyme defect.
Okay, so ATP7A gene, which is involved in Menke-Kinky hairy steely syndrome, and due to tyrosinase deficiency and copper deficiency, basically.
What enzyme deficiency?
Basically, it's tyrosine hydroxylase enzyme deficiency.
No, I think it's lysyl oxidase enzyme
Oh,
deficient.
sorry. Basically, copper deficiency. I have ATP7A gene and
It is
copper
due to
deficiency.
it. No doubt, it is due to copper deficiency, but enzyme involved is lysyl oxidase.
So,
Hello.
will I get half a mark for this?
No, doctor, that's not the thing. It's 1 or 0.
Ask me from surgery.
Surgery. Okay. This is again a question,
Hello.
a clinical case, a little smaller case. So, a child is posted for surgery for cleft lip. Which of the following methods is not used for repairing this condition? Not used. Okay. So, first option is Lee Massier's method. Second is Tennyson's method. Third is Millard's method. Fourth is Wardell's method.
That is okay. Just wait a second. I want to write this.
Yeah, no problem.
First is Miller's option. No?
Lay Massier's option. Lay Massier's method.
Le Massier's methods. Second,
Yeah. Tennyson's.
And fourth option is
Third is Millard's. Fourth is Wardell's method.
Miller's to used we use in cleft palate. I think it's option A because rest I heard about. Millard is right.
So what option will you go for?
What was the fourth option?
Wardell's method.
Vardier's method.
Wardell, Wardil.
I'm not sure. I think it's option A.
Option A is Lee Massier's method, right?
Yes.
Sorry, that's wrong. It's Wardell's method.
I was confused between the two. No problem.
Basically, Wardell's method is not at all used for these cleft surgeries. Others are used, basically you are right, Millard's method is used for cleft palate, but it can be used for combined cleft palate and cleft lip as well.
Yes, I also I haven't heard about Lee Mazier's method.
No
that
problem.
was-
That these questions
why I
I
was
also made
confused
wrong when I
between
did
the
first
two.
time.
So, doctors, the score is Dr. Adit 2 and Dr. Gunjan 0, unfortunately. Not no worries, so better luck next time. And the winner for team A is Dr. Adit. Okay, so let's move on to the next team. And heartiest congratulations on winning this.
Thank you so much.
Congratulations.
Thank you,
Thank you, Dr.
so
Gunjan.
much.
Thank you, Dr. Adit.
Thank you, Kusang. Thank you so much, Gunjan. Thank you.
Dr. Adit, we will contact you shortly, okay?
Okay, thank you, ma'am. Okay.
Thank you, sir. Thank you so much.
Okay.
It was lovely meeting you.
Thank you. Okay, same here, ma'am.
Hi, doctor. Welcome to the Battle of Sexes by DAMS-eMedicoz.
Yeah, hi, Dr. Sakil.
Sorry, I guess there is a difference. I'm Mukul.
Okay, no issues. Dr. Sakil,
Okay.
we will start with the Dr. Apurva. No
Fine.
issues. Maybe Dr. Sakil is busy. You can join us, and we'll do that battle of sexes with the Apurva, Dr. Apurva. Now, this is the battle of sexes, the team B, Dr. Mukul and Dr. Apurva. Now, you both may start your question.
Can I ask?
Dr.
Can I go
Mukul,
first? I want to go
hi,
first
yeah,
so
you
that I
go
get
first.
to know
Okay,
because I haven't prepared
okay,
anything.
okay.
You can ask me what subject should I say? Uh, Surgery,
Which is the most common tumor that has bone metastasis?
bone metastasis most common, breast,
No, it's prostate cancer.
prostate.
Yeah,
Holy shit. Oh God.
I have all the
No,
easy
first.
questions for this.
Okay, fine. The prostate. I guess it's wrong then.
Okay, so you asked me
Next would
from
be. Uh,
no, I'll say the subject OBGY.
mhm. What is the most what's the least common site for ectopic pregnancy?
Least common,
Yes,
least common.
I can
Can
give
you
you the
repeat?
options as well.
Hi,
Like
okay, give the options.
ovary, cervix, ampulla, fallopian tube.
Cervix maybe.
Yes, cervix it is.
Okay,
Okay, I have to choose a subject. Go with what? ENT.
ENT. Okay. So how can you define sudden sensory neural hearing loss?
30, 30, 30. 3 times 30, whatever it is.
But you need to tell that, or should I tell that? You are
Sorry?
like it's not 30. It's you are close only. It's loss of 30 decibels over three frequencies within three
Yes,
days.
yes means I meant that कि हर चीज को
Yeah,
30 30 like the definition is hard to remember. I was just remembered
yeah,
कि it is 30 decibel on 3 days on this
three
one
frequencies.
three
Okay.
frequencies.
So you wanted to be right or
You get the
wrong?
point. That's on you. Okay, wanted to be
It's on
right.
me.
It's right, of course, it's
It's
right.
not.
Yeah, it's on
It's
you.
not 30. It's three and three frequencies and 3 days.
Yeah. So I'm sorry, but if
No,
you
it is
wanted to
30
be
decibel, right?
Yeah, 30
yeah, it is
decibels.
But
30 decibels.
so apparently your question contained 3 things. Like it was just not one question, it included 3 things.
Okay, let give
Let
me the
it,
point.
okay, there. यार एटलीस्ट बैंक का अकाउंट तो खोल लें दो यार. It would
Okay,
be
okay.
so.
Okay, now my
What?
subject asks me
Yes.
PSM, maybe PSM.
What is the fertility? Which senses do we do for fertility indicators? Like we need total fertility rate. What is the senses? Like there are senses, no? Like SRS. What are which one do we do it for fertility? Like we need to know total fertility rate.
No, I have no idea about that. Do you have some options or
You want to have options, but you are not ready to
no?
even give me. Okay, fine. I'll give you options. You can at least have a guess. It is the census or SRS, that is dual one, that is done in 6 months one. And then you have this NHFS, Joe National Health Family Survey, that one. And then you have what? The civil registration, CRS.
National Family Survey, I think. I'm just guessing, I don't know.
What did you guess? Sorry.
National Family Survey,
You got
NFHS.
it correct. NHFS it is.
Yeah, which subject is?
Subject. What else is left? Pathology. Path.
Which is the stain to check the viability of myocardium in myocardial infarction.
TPTC within 4 hours.
Sorry?
Tetra TPTC. Tetra fo whatever it is.
Yeah.
Like I don't know what to pronounce. Like wait a minute. I'll give it a try. Tetra phenyl tetrazolium. Whatever. C. I don't remember.
Chloride, yeah, chloride. It's right.
Yes.
Okay, correct. Maybe anesthesiology. You have something.
Okay, fine. Can you just name any random, like any contraindications for N2O, nitrous oxide, any one? Like, you don't have to be any particular, anything where it is contraindicated. And give me
And
the
two is
reason.
no, no. Maybe
Like, there are a lot of one. Like, give it a try.
I don't want to guess. I'll guess something
Oh,
weird. Then
yeah. Let it be. It's not that weird. Like, it's very simple. You don't have to be like,
if I guess something weird,
no, no.
you can tell the answer if
Like,
you have it.
it's very simple. Will you tell the answer? It's
Yeah, you
basically
can tell me.
diffused in closed cavity. So whatever like pneumothorax or neurosurgery, wherever you have this closed cage right thingy, so it diffuses to that. So it's contraindicated.
Oh, okay, okay. In the neurosurgeries, right? Okay.
Yes,
Guys,
neurosurgeries, middle ear cavity, whatever.
guys, the score is two for Apurva and two for Mukul. So we need one more question. Who wants to answer and who wants to tell
Okay.
this?
What subject would you want to me to ask you?
Radiology, maybe.
But don't take it in any sense because I'm really good at quizzing. Like I have won gray matter initially, this dams only. So
Tabu, tabu.
and this
That's why.
like the last one, the gray matter. So I just wanted to enjoy. This is nothing like it's a fun for me. Radiology.
Okay.
Radiology. Can we go with any tumor? Do you know
Yeah.
tumor like you're fine with tumors? So tell me a tumor, the neuro tumor which has H3 to 27, like histone is there. Any marker, any
Stone.
tumor that. Let me give you a simpler one, I guess. Where do you see butterfly glioma?
Butterfly granuloma. Okay, I know this. Do you have some options? Will you give the options?
This is very simple. If I give the option, then it's gone. Like, if you want to attempt that one with options, you have two choices. If you want to attempt that one with options or this one with this.
Which one with options?
H3 K17M, the histone one, the marker.
No, 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 no. No options for that. Okay, I don't know. I don't know. I know this, but I can only tell with the options only.
Okay, fine. I'll give you
I
the
don't.
options. Glioblastoma, melanoma, oligodendroglioma, and subependymal giant cell astrocytoma.
Oligodendroglioma, I think. No?
This time you got it wrong. Luck was your own side, but this is glioblastoma. Sorry.
Glioblastoma. Okay.
No
Okay.
worries.
Okay.
Pharma.
From which subject? Pharmac.
Yes.
Okay, what is the adrenaline dose ratio in cardiac arrest, which we use in cardiac arrest?
Cardiac arrest, 1 is to, you give it 1 is to 10 lakh, matlab 10,000.
Yeah, 1 ratio
One is
10,000.
1 is to 10,000.
Yeah, 1 to
Yeah.
10,000.
So with this, Dr. Mukul wins, and Dr. Apurva, better luck next time. And it was lovely having you both here. Dr. Mukul, we
Yes.
will contact you shortly, okay?
Yeah,
So we are
sure.
in a bit of rush, so we will move on to the next.
And congratulations, Dr. Mukul.
Okay.
I'll get back to you
Thank
again.
you. Okay, okay, done. Thank you, ma'am.
Thank
Okay.
you.
Thank you and all the best to
Okay.
both of you.
Thank you.
Thank you, ma'am.
Thank you so much.
Now, the next team for the Battle of Successes is Dr. Masood and Dr. Tulsi. Now you can begin with your questioning.
So, should I give a subject of mine, my choice?
Yeah. First, you give me which subject do you
Um,
want from?
I think orthopedics.
Like, okay, I'll give you some options also. Which option is commonly injured in midshaft humerus fracture? Which
Which
nerve
is
is
commonly
commonly injured? Which nerve is commonly injured in midshaft humerus fracture?
okay.
Okay, I'll give you option. No worry.
Okay.
Ulnar nerve, first ulnar nerve, radial, medial, and axillary. Midshaft humerus fracture. In midshaft humerus fracture, which nerve is commonly
Radial nerve.
injured?
Radial nerve.
Yes, right. It's right. Right. I'll go easy. Give me some psychiatry question.
Okay. Psychiatry. Um, okay. So, what is the among the following options? Yeah, should I give options also?
It's your choice. If you
Okay.
want to give, then it's okay.
Among the following options, which of the following drug is an anti-smoking drug, which
Okay.
is also an antidepressant or an antipsychotic? Options are um, bupropion, aripiprazole, risperidone, and quetiapine.
Bupropion.
Okay.
It's bupropion.
Right. I just gave the answer on the first option. It was
No,
okay. It's
I
fine.
knew it.
Okay. No, I'm not saying you didn't knew it, but I was not prepared with the options. Okay. Option gynae.
A preeclampsia pregnant woman, a patient with preeclampsia,
Hmm.
and he's on Maxulf. Okay, he's on
He's on
Maxulf. The
Maxwell.
what? Okay, what is the first sign of
Okay.
Maxulf toxicity?
Okay.
First sign of Maxulf toxicity.
Loss of descendant
Okay,
reflexes.
yeah, that's right.
Huh.
You don't need option. Wow. Okay, then my term. FMT.
Among which of the following metal compound poisoning which presents as alopecia?
What?
Which has
Repeat,
a
please.
among the following metal poisoning which also
Uh,
has a feature of alopecia.
okay,
Okay. So the
option.
options are lead, mercury,
Okay,
thallium, and that the fourth option was arsenic.
lead, mercury,
Lead, mercury, thallium, arsenic.
arsen,
No, it's thallium.
thallium.
Yeah.
Okay. Then
Okay, guys. Right now the score is Dr. Masood is on score 1, and Dr. Tulsi has a score of 2. Right?
yeah.
Okay.
Yeah. So this is the last question, and it is a decider question. ठीक है कि who is going to be the winner?
Radiology.
String sign on barium study. String sign on
Uh,
barium study. In which characteristic of you have to tell
which disease?
which disease?
Okay. One second. I'm confused between two. Can I get options?
Okay.
Okay.
Aclasia,
Hmm.
pyloric stenosis, Crohn's disease,
Hmm. Hmm.
and Hirsch. I don't know that name. Hirschsprung disease and something. I don't know.
It's a
Okay, I'm
Hirschsprung
giving
disease.
you. Yeah, right.
These are the options.
Yes, yes.
I think it's congenital hypertrophic pylori stenosis.
No, Crohn's disease.
Oh, damn.
Next, my
Okay.
turn. You can give me PSN question.
Among the following options, what is the, that insecticidal net used for insecticidal net,
Yeah, yeah.
long lasting. So, what is the size of the small area, surface area of the small, that hole of each,
Yeah,
the net?
I knew, but you have to give option just because of these
I'll,
are
I'll give, I'll give options.
okay.
I'll give options.
Okay.
Uh, okay. Yeah, I was about to ask what is the number of that holes in the net. That was the INICET
Yeah,
question,
I
I think.
yeah, you can give me option. I'll give answer.
Okay.
Give me
Okay.
options.
Okay. The answer is 130, 140, 150, 160.
Shit. Okay, repeat please.
The number of
Options.
holes in that insecticidal net. That was a direct question.
Okay.
So 130, 140, 150, 160.
Number of hole. Okay,
Hmm.
it's basically 156 like 160.
It's 150.
150. It's I'm stuck between. I mean, okay, it's a okay.
Okay,
Then you
guys. So
win.
so the score is Dr. Masood is on score 1 and Dr. Tulsi has a score of 2. So our winner is Dr. Tulsi. Dr. Masood, better luck next
Yeah,
time.
yeah.
And Dr.
Congrats,
Tulsi,
congrats.
we'll be contacting you shortly, okay? So it was lovely
Yeah,
having you both.
congratulations, Dr.
Thank
Tulsi, and best of luck to
thank
both of you. Dr. Tulsi, I'll get back.
Thank you, ma'am.
Okay, okay.
Thank you,
Thank you.
Okay, thank
Thank
you
you
so
so
Thank you,
much.
much.
Masood. Thank you.
thank you.
Yes. The next team for the Battle of Sexes is Dr. Akash, Dr. Shikha. And now you can start with your questioning.
आप स्टार्ट कर दो सर सब्जेक्ट पीएसएम
PSM, what is the ideal value of calcium for pregnant women?
आईडीए ऑफ
Ideal value of calcium for pregnant women.
जस्ट अ मिनट ऑप्शंस
Option
मिल सकते हैं
600 mg, 800 mg, 1000 mg, 1200 mg.
इट्स 800 mg
No, 1000 mg.
1000 ओके 800
Option C was correct, 1000 mg.
ओके
Okay, so now your chance to ask me. So, psychiatry.
इजी व्हाट इज आईपीसी 84
McNaughton's.
यस
Okay, now your subject. The second question.
एफएमटी
Which IPC denotes the punishment of rape?
व्हिच आईपीसी
Denotes the punishment of rape.
रेप 375
No.
rape is IPC 375 and BN is 63
Definition is 375. Punishment is 376.
you asked which rape definition not
The punishment of
sorry
which IPC denotes the punishment of rape?
sorry I didn't hear the term punishment actually it's okay
Chalo, koi nahi, we can give this
because
point to Dr.
375 is IPC and
Anyhow,
then
our teachers are
onward punishment is there
correct. Koi baat nahi, an honest mistake. So we can give 1 point to Dr. Shikha.
Okay, next subject, gynecology. Sorry, orthopedic. Orthopedic easy रहेगा gynec से.
ऑस्टियोसार्कोमा की मोस्ट कॉमन साइट क्या रहती है मोस्ट कॉमन साइट फॉर ऑस्टियोसार्कोमा
Most common site for osteosarcoma. Options है
एक्चुअली मैं बोन्स बता सकती हूँ बट पर्टिकुलर ऑप्शंस देने पड़ेंगे आपको इट्स proximal end of femur end of femur proximal end of radius or distal end of radius
osteosarcoma. प्रॉक्सिमल डिस्टल एंड रेडियस नहीं हो सकता. फीमर में से इट इज डिस्टल फीमर.
Yes, correct.
Okay, so Dr. Akash is on 2 points and Dr. Shikha is on 1 point. So this is the last question now. So guys, ask each other, please.
In pathology, you have heard about HOCM, hyper obstructive cardiac.
Sorry?
HOCM in pathology, you have heard about it, right?
H what?
HOCM, hypertrophic obstructive cardiomyopathy. HOCM के बारे में सुना है आपने?
Hypertrophic
cardiomyopathy.
cardiomyopathy, yes.
There is a murmur in that. So what happens to the preload and afterload that will increase the intensity of murmur? What happens to the preload and afterload that will increase the intensity of murmur? प्रीलोड आफ्टरलोड को क्या होगा जिससे HOCM के मर्मर की इंटेंसिटी बढ़ेगी?
Options? You're giving options, right?
Options. Option A, increase in preload, decrease in afterload. Option B, decrease in preload, increase in afterload. Option C, decrease in preload, decrease in afterload. Option D, increase in afterload, increase in preload.
I guess option B, both decreased. I guess both decreased. Both decreased preload and afterload.
Yes, it's correct answer.
Okay.
Subject PSM.
Mixing of prickly poppy seeds with mustard seeds leads to a condition, toxic symptom, leads to a toxic symptom condition, right? Which toxin is included in that? Toxin.
Options.
Name the toxin.
पॉपी सीड का टॉक्सिन है जो मिक्स किया जाता है जो टॉक्सिसिटी प्रोड्यूस करता है और सिम्टम्स आते हैं तो टॉक्सिन बताना है. ऑप्शन बोल देना. सैंग्विनरिन.
Yeah, right.
Okay, guys. So the winner is Dr. Akash. He has got he's got all the 3 questions correct, and has got 2 correct. So thank you so much. It was lovely having you here, Dr. Akash. We will connect to you shortly, and thank you so much, guys.
Yeah, Dr. Akash, congratulations and all the best for your question. Dr. Akash, I'll connect you soon. Thank you so much.
Thank you so much. Thank you. All the best.
Yeah, hi, Dr. Mustatif and Dr. Ananya.
Hello.
The next team for the Battle of Sexes is Dr. Mustatif and Dr. Ananya. You just start your one.
First of all, I will go with PSM.
Okay, so for how many liters of water is one chlorine tablet required for? So one chlorine tablet is required for the chlorination of how much amount of water?
One chlorine tablet, na?
Yes.
Like you will give options or I will have to give answer directly?
That's okay. 20, 30, 40, 50.
I'm not sure about tablet, but I guess 30.
No, the correct answer is 20 liters.
Okay.
My subject of choice would be obstetrics.
A 26-year-old female with infertility
Okay.
and is diagnosed with bilateral corneal block on hysterography.
Okay.
And then what will be the next step? How will
So, if for fertility specifically, we'll go for IVF, पर उससे पहले हम क्रोमोपर्ट्यूबेशन करेंगे एंड हम क्रोमोपर्ट्यूबेशन से पहले उसकी सैल्पिंजेक्टमी करके उसका फ्लूइड ड्रेन कर देंगे बिकॉज दैट इज फीटोटॉक्सिक फॉर द फीटस.
Before that, we will check with laparoscopy and hysteroscopy, I guess, and then we'll go further.
So क्रोमोपर्ट्यूबेशन में
yeah,
हाँ
it's
क्रोमोपर्ट्यूबेशन इज लैप्रोस्कोपी आई गेस.
Yeah, it's okay. You are correct. Let it be ortho.
Tell me syndromes associated with enchondromas.
Enchondromas.
Yes.
Syndrome associated with enchondromas would be Ollier syndrome and Maffucci syndrome.
That's correct.
In
I will take ENT.
What are the 2 structures which make the Pesabens ridge?
The
Pesabens range.
Oh, okay. So I think one is posterior pharyngeal wall, and there is one muscle which I
Posterior
don't
pharyngeal
remember.
wall is a posterior pharyngeal wall is a vague muscle. Like what specific muscle from posterior pharyngeal wall?
I am not sure about this. I'm not. Can you give me options?
Yeah, I can give you option. First option would be palatoglossus muscle plus middle constrictor muscle.
Okay.
Second would be palatoglossus plus superior constrictor muscle.
Okay.
Then option C would be palatopharyngeus muscle and superior constrictor muscle.
Okay.
And option 4 would be palatopharyngeus plus middle constrictor muscle.
I think I would go with option C, palatoglossus plus pharyngeus.
No, it should be palatopharyngeus plus superior constrictor muscle. Superior constrictor
Palatopharyngeus.
from
I think that is what
plus
you gave
superior
as the
constrictor.
C option. I think I'm not sure. Whatever. Up to you.
I jumbled up only. But you said palatoglossus plus palatopharyngeus. That was not the correct answer.
But I'm because there was no option as that. Okay, fine.
I don't remember the sequence of option actually. I just made it in my mind right now.
Koi nahi, we
Okay.
would not give this point to Dr. Ananya. I'm sorry.
Okay, fine.
Can you ask from micro?
माइक्रो में आप मुझे बता सकते हो कि बैरल शेप्ड स्पोर्स कौन से फंगस में मिलते हैं?
कौन से फंगस में?
हाँ जी. ऑप्शंस तो?
Yes, it would be helpful.
स्पोरोट्राइकोसिस, ये हिस्टोप्लाज्मोसिस, कैंडिडा and coccidioidomycosis.
Option D, coccidium. Option D.
That's correct. I would take my third subject to be radiology, I guess.
I will give you 4 options. Among the 4 options, in which disease we would see rib notching superiorly?
Okay.
Option 1, coarctation of aorta. Option
Mhm.
B, hyperparathyroidism. Option C, aortic dissection. And option D, rickets.
It's definitely not A because हमें उसका inferior notching मिलती है. और I want to go with hyperparathyroidism, but I'm not sure.
Yeah, that's correct. I thought you would say coarctation of aorta, but yeah,
नहीं
it's
coarctation of aorta
hyperparathyroidism.
हाँ figure of 3 मिलता है ना उसमें notching नहीं मिलती.
Yeah, it's hyperparathyroidism.
Okay. आप I guess हो गए ना सारे questions?
हाँ
और you're
guys,
left with them.
3 क्वेश्चन
आप
तो हो
लोगों का
गए.
स्कोर 2-2 है, तो एक क्वेश्चन और एज अ टाई ब्रेकर.
I would go with forensic medicine.
Specifically, Danbury shakes कौन सी poisoning में होता है? Lead, thallium, mercury या फिर arsenic?
Danbury shakes. I am confused between lead and mercury. I think it should be mercury.
That's the correct answer. Pediatric? I think. I'm not sure.
Pedia. Like I will give you 4 options.
Mm-hmm.
Among the 4 options, which is the most common hepatitis virus to cause chronic inflammation in children?
Okay.
Is it
Options?
hepatitis B, hepatitis C, hepatitis D, and hepatitis E? B, C, D, E.
B, C, D, E तो B, D और E तो आउट ही हो गए. B और C में से C मतलब क्योंकि B शायद अडल्ट में होता है कॉमन तो C होगा.
Yeah, it's correct. Hepatitis C.
यार तुम लोगों ने फिर ट्राई कर दिया.
एक क्वेश्चन आप पूछ लो हम दोनों से एंड आई थिंक बजर राउंड कर लेते हैं.
तो गायनोकोलॉजी में से माय क्वेश्चन इज इन्वेस्टिगेशन ऑफ चॉइस एंडोमेट्रोसिस इज
लैप्रोस्कोपी.
करेक्ट. So the point goes to Dr. Ananya. Okay, and congratulations to both of you because you gave each other a
Thank
very
you.
tough competition. And
Thank you.
Dr. Ananya, we will connect with you very soon. Dr. Mustafiz, thank you for being there, and it was lovely having you both here.
Thank
Thank you.
you. And
Thank you so
congratulations.
much.
Congratulations, ma'am.
Yeah.
And all the
Thank
best
you.
to both of you. Dr. Nanya, I'll get back to you.
Okay.
Thank you so much.
Congratulations. Thank you.
Thank you. Thank you.
Ramya, from which subject you want the question?
I would like to ask from OBG.
A tumor marker for granulosa cell tumor.
Tumor marker for?
Granulosa cell tumor. Options are
I couldn't
estrogen,
hear you.
granulosa cell tumor.
GCT.
Ah.
Options?
Inhibin A, inhibin B, estrogen, progesterone.
Inhibin B.
Physiology.
Thyroid hormone has receptors on the nucleus or the cell membrane.
On the nucleus.
Okay.
Your next subject.
PSM.
Okay, vitamin to prevent lethaidism. Vitamin A,
Vitamin to
vitamin C,
prevent?
lethaidism.
Vitamin C.
Okay, correct. My next subject is
So which subject next you? Pathology. What is the stain used for identifying H. pylori?
Warthin's tariffing.
Okay.
Guys, right now the score is 2 for Dr. Shreya and 2 for Dr. Ramya. You are like moving एकदम साथ साथ में. तो अब you can do थोड़े मुश्किल क्वेश्चन पूछ सकते हो एक दूसरे से so that we can decide a winner very easily.
My next subject is dermatology.
Most specific nail sign for the psoriasis. Options are like psoriasis, most specific, not most common one. Options are like leukonychia, crumple vapor, like pterygium. Third option is red drop of lunula. 3 options are enough, I think.
Psoriasis, right?
Yeah.
I think red spot on the lunula.
Okay, yeah, correct. I want last question from Pharmac.
For better absorption of the drug, the drug should be in dash form, ionic or non-ionic, for better absorption.
Non-ionic.
Okay, correct.
Okay, guys, right now you both are at the score of 3. Okay. So, what do you want? Do you want to ask each other one more question, or should I ask one question as a tiebreaker? Whoever answers it the first wins.
You ask.
Okay, I'm asking a question from microbiology. Floppy baby syndrome is due to what?
Botulism. Botulism.
It is caused by what?
Clostridium
Like
botulism.
Very good.
Clostridium.
The point goes to Dr. Shrey. And our winner is Dr. Shrey because he has a point of 4. So Dr. Shrey will be contacting. Yeah, Dr. Shrey will be contacting you shortly. Dr. Ramya, it was lovely having you here.
Yeah, congratulations, Dr. Shrey. And all the best to both of you. Dr. Shrey, I'll get back to you.
Thank you, ma'am. All the best, Ramya.
Thank you.
Thank you.
Now, the next team for the Battle of Successes is Dr. Sachin and Dr. Anjali. You may start your questioning, sir.
So, which subject should I have?
Surgery.
The restriction of the fused kidney is due to which of the following artery?
Superior mesenteric artery.
No, it's inferior mesenteric artery.
Inferior mesenteric. Okay. Your subject?
I want from derma.
Modified Casper criteria is seen in?
Psoriatic arthritis.
Good. It's correct.
Next subject here.
PSM?
Multipurpose workers were formed in which of the following committee? Chadda committee, Kartar Singh committee, Then Tendulkar Committee, yeah, none of the above. Multi-purpose
Chadda
workers
committee.
were formed. Multi-purpose worker were formed in which of the following committee? Chadda, Kartar Singh, Tendulkar, yeah, none of the above.
Kartar Singh committee.
Yes, it's Kartar Singh, correct. From pharma, you can ask.
CYP 2E1 is like which drugs are maintained like metabolized via CYP 2E1.
2E1. Can we like give options because it's like it's not main enzyme. No, you have asked something extremely different.
Okay. For which drugs metabolism mainly it is responsible, for which class of drug metabolism it is responsible?
I don't know. I need options. Otherwise, I can't. I
Like
don't know.
NSAIDs, antimicrobial, or NSAIDs, antimicrobial, and GIT, some
Antimicrobials.
no, for fever drug, NSAIDs metabolism it is responsible.
Okay. Your next subject.
ANAT.
Which of the following muscle is not included in the pes arsenus group?
PES arsenus group.
Yeah. Options if you want: semitendinosus, semimembranosus, pes arsenus group. Which of the following is not the muscle?
Okay, options are semitendinous or semimembranous.
Uh,
Which of the following is not included?
yeah.
Second option,
Which one?
semimembranous.
No, it is semitendinosus.
Okay, but actually I read. Maybe can we cross check?
Yeah, sure. You can cross check. Sure. If I may be wrong, you can cross check.
Okay, like how to cross check? I don't know.
Or let me ask you another question if you are not like thoracic duct passes through which of the following like foramen in diaphragm at what level? T8, T10, T12, L1. Thoracic duct.
T10.
No, it's T12.
Okay,
And this time I'm sure it is T12 only.
okay, ठीक है. हाँ, it's T12 only. I learned in mnemonic. That's why I went wrong.
Yeah. You can ask me from
Next,
like patho. You can ask.
dry tap is found in which like anemia?
Like it is found in aplastic
On
anemia,
bone marrow
myelofibrosis.
aspiration.
Aplastic anemia. Yeah.
Yeah, it's correct.
Okay, so the winner is Dr. Sachin as he has a score of 2. So Dr. Sachin, we would be connecting with you shortly.
Sure, ma'am. Sure.
Dr. Anjali, it was lovely having you here.
Thank you, ma'am. Same here.
Thank you.
Congratulations,
Dr.
Dr. Sachin.
Thank you, ma'am.
And best of luck to both of you. Dr. Sachin, I'll get back to you again.
Sure, ma'am. Sure, ma'am. Thank you, ma'am.
Thank you so
Thank
much.
you so much.
Thank you, ma'am.
Thank you, ma'am.
Now the next team for the Battle of Sexes is Dr. Rohit and Dr. Riddhi. You just start your questioning.
Tell me which subject you want to take the question.
Ops.
Okay, tell me in monochorionic diamniotic twins, okay, cell divisions occurs after how many days of post-fertilization?
Monochorionic diamniotic. After 8 days?
Yes, it's correct. It's 4 to 8. Of paid, you ask me.
What is the normal age of presentation of measles?
It's 2 years.
You have to give a range.
1 to 2 years.
Okay. So how can you, like what is the sign of healing rickets radiologically? Like I've changed the question for pediatrics.
Okay. It is the appearance of white line in between the that is growth plate and the metaphysis.
Yeah, that signifies what? Like
it signifies the healing, actually process of healing.
okay. The healing means of calcification.
हाँ. अच्छा, yes सुनना था क्या? but I want to say that it's between the. You have to. You asked the radiological finding, then I told you it's between the metaphysis and growth plate. That's
Oh, okay.
okay, ma'am.
Surgery.
Surgery. Okay. Uh, Tell me the boundaries of pain. A triangle of pain.
Triangle of pain. I have no clue.
The triangle of is by testicular artery and peritoneum and the iliopubic tract.
Okay, got
In
it.
laparoscopic hernia repair, it's. Then you ask me from OBG. You ask.
What is the definition of primary infertility?
Okay. Primary infertility is defined as the inability to conceive. Uh, Inability to conceive for 1 year after regular intercourse. मतलब continuous intercourse.
Yeah, yeah, okay. Regular sex means unprotected intercourse. Yeah. Medicine, mostly from CVS or
Tell
SP.
me. Okay. uh, CVS. Tell me what is Paget sign?
Fragile sign. I don't know the answer.
Actually, it's seen in typhoid in which the pulse rate does not increase in proportion to the increase in body temperature.
Oh, acha, relative bradycardia, you're saying?
Ha. Yes, yes, yes.
Okay, okay, got it, got it.
You ask from radio.
What is the BIDAT score for highly suspicious breast cancer?
Okay, highly suspicious. It is 5. 5 yes.
No, it is 4, right? 5 is when it is means it is diagnosed that
Acha.
it is by
No, no.
biopsy.
Biopsy proven is 6. Biopsy proven is 6.
Yeah, and 4 is highly suspicious.
Okay, okay, okay.
Okay, guys. So now the score is 2 for Dr. Rohit and 1 for Dr. Rithi. So the winner is Dr. Rohit. Dr. Rithi, it was lovely having you here. Dr. Rohit, we will contact you shortly. Congratulations.
Thank you.
Okay, ma'am.
Congrats, Dr. Rohit, and all the best to both of you. And Dr. Rohit, I'll get back to you again.
Okay, ma'am.
Thank you.
Thank you.
Thank you, ma'am.
Our
You tell
next
the
team
subject.
is Dr. Adib and Dr. Apurva for the Battle of Successes. Now you can start your program.
You can go first, Apurva. Let's start with pathology. Path.
I'll just ask simple questions. Don't worry. Don't worry. Don't worry.
Okay, okay.
What is the pattern for Leishman?
Pattern as such, I mean, there's a enzyme deficiency of
Hereditary.
HGRPTase and
No,
nails
no, no, no.
and
Hereditary pattern.
acha,
Like it's
hereditary pattern. Is it X-linked recessive?
it is X-linked recessive. Yes. You can ask me now. You ask me from
Yeah,
pharma.
pharma. Okay. I will also go with the easy one first. Tell me what is the mode of action of inclisiran?
Inclisiran.
Okay, sorry. I mean, sorry. Let me reframe. Let me change the question. This is not an easy one. What is the mode of action of rituximab? Rituximab.
Rituximab is CD20 inhibitor.
Correct. It is anti-CD20. You can ask
Can you
me
tell me the?
question from.
Can you just tell me the inclisiran wala answer?
Okay, inclisiran is basically a siRNA targeting PCK9 receptor.
PCK9.
PCK,
Yeah.
yeah. You can go with medicine.
What is the drug? Anti-diabetic drug, which causes MI.
Could you please repeat the question? Your voice was breaking in a bit.
Anti-diabetic drug causing MI.
Okay, anti-diabetic drug causing MI. I don't remember this. MI causing. Is it some sort of semaglutide or that sort of drug in that class?
Yeah,
Does it
you
belong to
close.
that?
No, not exactly same class, but it's. May I tell the answer?
Yeah, sure.
It's
I don't know this.
rosiglitazone.
Rosy glitazone. Acha, glitazone, pioglitazone. Oh,
Yeah, yeah, yeah. DPP4.
nice.
Okay,
Thank you.
you can ask me from PSM.
Yeah, so tell me this. What is the protective efficacy of TB vaccine? BCG vaccine that we give, what is the protective efficacy? Uh, how much of efficacy, well, what is the protective efficacy of BCG vaccine when it comes to controlling TB, when it comes to preventing serious uh, serious episode of TB?
Uh, is it a range? Can I say in a range?
Yeah, it
Or
is in a range, and you will have to tell me the range.
50 to 80?
You're close, but it is
20 to
actually
50?
0 to 80. 0 to
Acha,
80.
0 to 80. Okay, okay, okay.
Yeah. It's a very interesting fact because according to this data, in some of the searches, the BCG vaccine provides 0% protective efficacy. Let's go with physio. You can go with pharma also if you want. You can also
Okay,
go with
okay.
micro. Leave pharma, micro, please. Micro.
Micro, you tell me. Albert Stein का वो बता दो. Composition.
Albert Stein. अच्छा, अरे यार, I don't remember that. Is it carbon 5% carbon fiction? नहीं, ये तो वो था. नहीं, I don't remember. Sorry.
Albert Stein का वो पूछा था ना?
Yes, yes.
Actually, मेरे को भी याद नहीं आ रहा है. Can I change the question? Can I change the question? You
As
tell
in
me.
that,
You tell
you
me.
can change the question.
Loftless serum किसमें use होता है? Very simple, very basic.
Loftless serum. Is it for Ascaris? Acha, Loftless serum is used for Corynebacterium diphtheria.
Yeah, I'll go with that.
Okay, tell me, what is the gene mutated in Peutz-Jeghers syndrome?
STK11.
Correct, it is STK11.
Okay, guys, since it is a tie, so you can ask each other
तो
one more
tie हो गया,
question.
ma'am.
Let's go with FMT, forensic medicine.
रेसेस्पा क्या लेक्टोर और whatever that is. तो उसके क्या वो होते हैं? Condition क्या है उसकी?
क्या? Condition as in, it is it comes under the medical negligence wala topic, but what exactly are you asking? I don't understand. Condition matlab?
मतलब under what condition is it applicable? Okay, let's
Voice.
just change the question. Let's
अच्छा,
just change the question. Lead poisoning में lead poisoning में what is investigation of choice?
अच्छा, you look for urobilinogen. No, sorry. Some investigation of choice as in what?
Diagnosis. Like how can you
We can get
diagnose?
a lot of things done, but there was one enzyme that one compound that we looked out for in the urine.
That is exactly what
Uroporphyrin.
it is.
Uroporphyrin.
Yes. It's uroporphyrinogen. But you're right.
Uroporphyrinogen. Okay.
So we
Tell me
can
the
go
subject.
with the radio.
Okay, tell me, uh, where is the light bulb sign seen in X-ray?
I've read it. I should know it. Light bulb. Appendix?
Light bulb, it is not exactly seen in appendix, but surgery में था ये शायद what you're talking about light bulb in neuroblastoma में था शायद. But I'm asking कि X-ray में कहाँ दिखता है? Is the hint it is related to a bone and मतलब some sort of bone कहीं पे, not a solid organ.
Okay. Light bulb. Acha, light bulb yaar. Some cancer. I don't remember. Giant cell tumor. No.
नहीं, मतलब what I was looking for was, shall I tell the answer or
Yeah,
are you
you
going
can
to?
tell.
It
Okay,
is
just let
seen
me.
in posterior
Okay.
dislocation of shoulder.
Okay.
Okay,
So
guys,
you
so
win.
the score is 3 for Dr. Adeep and 2 for Dr. Purva. So our winner is Dr. Adeep. Congratulations. Apurva, it was lovely having you here. Dr. Adeep, we will contact you shortly.
It was a nice
Congratulations.
experience. Thank you so much, ma'am.
Yes.
Thank you so much, ma'am.
Same.
And thank you, Apurva, for being such a nice quiz master.
Not very nice quiz master.
नहीं, it was
Sure.
nice.
All the best to
Okay.
both of you. And Dr. Deep, I'll
Thank you.
get back to you.
Okay, ma'am.
Thank you
Thank
so
you so
much.
much.
Thank you.
Thank you so much.
Thank
ma'am.
you.
Okay, the next team for the Battle of Sexes is Dr. Ragesh and Dr. Ishika Agarwal. You just start your questioning.
Tell me the subject.
Opthel.
So you want a one-word answer, right?
Okay.
Okay.
Anything.
I can ask you a simple question. The ciliary muscle develops from what structure?
Means you want to ask the layers.
Ciliary muscle. You know that ciliary body has a muscle.
Yes. Okay.
Yeah. What
It
does
is
mean?
from
Where does it develop from?
Okay. From the neuroectoderm, matlab neuro layer.
Neuro what?
From the neural crest. No, sorry. Neuroectoderm.
Okay, actually the neural crest cells was the right answer. Neuroectoderm is actually ectodermal structure. It is from notochord. It divides into neuroectoderm and surface ectoderm. A neuroectoderm actually gives rise to the retina, etc. Like the ROM structures, retina, optic nerve, and retina memory epithelium also. So you can ask me the question. Okay, subject, right? Okay, you can ask me a
Yeah.
question on anatomy.
Winging of a scapula is due to which muscle paralysis?
Actually, there are two wings to scapula. Medium wing of scapula is due to palsy of the serratus anterior muscle. It is due to longo-thoracic cave injury. Or it can be lateral wing of muscle. It is actually due to trapezius palsy, lateral part.
Yeah. ENT?
Okay. What is Gressinger's sign?
Gressinger sign
I mean, it's seen in what condition? Simple question. It is seen in what condition?
lateral sinus thrombophlebitis.
Yeah, it's lateral sinus thrombophlebitis. Ask me a question in medicine.
Okay. Tell me the keywords. Okay. Some keywords are there for the specific diagnosis. Keyword for the cardiac tamponade.
Cardiac tamponade. Actually, it has the back stride, which is characterized by muffled heart sound, hypotension, elevated GVP.
Yes, right.
Tried. Then you can also
And
have
the one.
pulses.
Yeah. Okay.
What?
Actually, I will tell you. I want to listen the absent virus, and that is free. That is also specific for cardiac tamponade.
What?
Absent Y descent that is seen in cardiac tamponade.
Yeah, absent virus, and that is also seen in cardiac tamponade.
Keyword.
So it's also seen in constrictive pericarditis, actually.
Okay. Medicine continue. Yeah, obscany we can take.
What formulation of iron can be given? Like there is no restriction for the dose limitation. What IV iron formulation can be given without dose regulations? It was actually a INICET November question, 2024.
Okay. I don't know, but I can guess about 1000 milligram. Sorry,
I
but
mean,
I don't know.
not. I just want the formulation name. I don't want the dose. I just want the formulation name.
Acha, okay, I understood.
Dr.
Okay,
Ishika, you can
that's
ask for
patient
options as well.
hemoglobin minus something.
You can ask for options as well.
Okay, do you want the option?
Acha, okay. Yeah. Actually, I
Okay.
am confused. Patient hemoglobin minus something, and we add.
That is the equation. I just want not the formula, the formulation. Like, is it iron sucrose? Is it iron maltose? Is it iron carboxymaltose? Is it iron sulfate?
Okay.
Yeah. So
Okay,
that's the four
acha,
options.
okay. I didn't understand your question. Acha, you are okay. FCM, pericarbic, no, iron sucrose.
Actually, it's for carboxymaltose. Iron sucrose has a dose limitation of 200 milligram per dose. I mean 200 ml.
Okay.
I'm not
My
sure, but
bad.
there is dose limitation. You can give only 2 doses per week.
Okay, my bad.
Dr. Ragesh has a score of 2 and Dr. Ishika has a score of 1, right?
Okay, radiology.
If you can. Okay, radiology, I can. But I can't formulate the hard question about it.
That's why I gave you dermatology and radiology.
Very sharp. Okay. Actually, one
Ask me.
question was asked before.
What?
Lung abscess, DD in radio, you can tell?
Lung abscess DD in radio.
Okay, I will formulate a question. No, I will formulate a new question. Lung abscess, and which fungus? Yeah, that is a simple question actually.
Lung abscess and which fungus? What do you mean? Like, what is the resemblance or a similar
Matlab,
picture?
no,
Like a
lung abscess
monocyte
caused by
in
which fungus
aspergillosis,
we
that's what
will.
you mean?
Yeah.
Okay. And you want the aspergillosis, it's actually
Okay.
allergic bronchopulmonary aspergillosis. In invasive aspergillosis, you actually see a different picture. It's a allergic bronchopulmonary aspergillosis, you will see a monocyte which is present in a secondary TB or like a cavity should be found, like
But
nasal secondary or
lung
carcinoma.
abscess,
Yeah.
which what that word is?
In lung abscess, you don't have a gap. There is in monocyte, there is air is present around the fungal ball, and it actually moves. In lung abscess,
But
it is actually hemisphere shaped. Like it will be half filled
okay, but
fluid.
that like you told, the aspergillus bronchopulmonary invasive and that lung abscess wala what? Actually, maybe I missed, but can you
What?
repeat?
Like invasive wala?
मतलब you told na allergic bronchopulmonary
Bronchopulmonary
aspergillosis,
aspergillosis.
then
Yeah.
invasive. वैसे ही lung abscess का क्या एक word था ना जिसके अंदर ये है? You get it? What I want to say?
I didn't get your question. Like allergic bronchopulmonary aspergillosis, invasive aspergillosis, and
And
what?
one more in which this finding lung abscess, monad sign, what you are saying, and one more sign is there in
In what? In allergic bronchopulmonary aspergillosis or invasive aspergillosis? Which one?
ये दोनों में नहीं in which मतलब
Oh,
my question is that ना in which fungal infection lung abscess is seen.
which fungal infection is lung abscess seen? Is that your question? Okay, then I would
Okay.
go for
I
it.
think we both are confused. Let it be. We see the lung abscess now in pre-existing cavity that fungus came. I want terminology for that. You get it?
Lung abscess, pre-existing cavity. What terminology? Like, what do you mean by terminology?
Like she
Fungal
needs a term for
infection.
that.
For infection
Like
in
that fungus
like,
will cause,
yeah, fungus
like
will
you told
cause.
na, allergic bronchoinvasive. That word I want actually. You're not getting it. Okay, maybe, and or maybe I'm not able to think properly.
Wait. What word do you want? Like in lung abscess, or like, do you mean by a radiological sign, or do you mean the fungus name, or any
I
condition caused
want the
by
fungus
fungus?
name.
Fungus name.
Condition and fungus
It is
name. In respiratory
aspergillosis.
medicine, we study it. Aspergillosis.
Yeah.
Okay, but actual name is aspergilloma. That I want to listen. You get it?
Oh, the fungal ball.
In aspergilloma, fungal wall actually. Yeah.
Okay.
Okay,
I
okay.
didn't
So
understand that.
this point goes to Dr. Ragesh. So Dr. Ragesh, right now you are at a score of 3, and Dr. Ishika, you have a score of 1. So guys, the score is 3 for Dr. Ragesh and 1 for Dr. Ishika. So our winner is Dr. Ragesh. Congratulations. And Dr. Ishika, it was lovely having you here. Dr. Ragesh, someone from the team will contact you shortly. Okay.
Okay, congratulations, Dr. Rakesh, and all the best, Dr. Ishika. Thank you for participating. Thank you, ma'am.
So guys, since we had more participation from the girls, so the last team is her versus her. Okay.
Yeah, sure.
Yeah, the next participant for the Battle of Sexes is Dr. Soumya and Dr. Zia. You just start your questioning.
So, which subject do you want me to ask?
An art.
So, a NET question with options, na? Right coronary artery comes from which part of the aortic sinus?
Aortic sinus, anterior one.
Okay.
The anterior sinus one, the right coronary artery emerges, and the left posterior from left coronary artery.
हाँ ठीक है.
Okay. Now you tell me your
Yes.
subject.
Micro.
Infective form of toxoplasmosis to humans from cat feces.
Infective form of toxoplasmosis.
Yeah, infective form of toxoplasmosis. I'll give you options. No,
It's
ready. Yeah.
Wait. Toxoplasmosis is a protozoan and it has three stages basically: the tachyzoids, the bradyzoids, and the sporozoids. So you want all of the all are toxic to the
Yeah.
infective form.
I'm asking. Yeah, I'm asking. No.
All of them, like there are three
No, from
stages.
cat feces.
From cat feces.
Yeah, but the oocyst is specific. Yeah, it's okay. It's okay. Oocyst is specific.
Yes. Like because all the three forms are the infective forms.
Yeah, but the oocyst is the specific one. Which
Okay.
you can ask me from PSN.
What is the hierarchy which is used in a research proposal for determining its strength? Means which studies have the which hierarchy by which we like score the studies, which score is considered the most highest good value and in reviewing it as well. Like the tools we use different tools in different studies now. So which tool, like which study, like there are different type of studies also. So when we are looking
You're
at
asking like randomization and blinding. You're asking like this sorts of thing. Huh? I guess. You're
like
asking this.
like basically it's cohort study, case control study, meta-analysis, like arrange them in hierarchical order when you look for the answers or do for a research review. Like which studies do you prefer more?
RCT and then cohort case control.
The first one, which is the first one?
RCT only.
It's meta-analysis. It's meta-analysis. Yeah, meta-analysis.
Yeah.
Then second one.
I'm not sure, but I guess it's RCT then cohort case control, like to know the proper relationship.
आगे like we have आगे case control के बाद.
Yeah, आगे case control.
Yeah, you have to. The options are case studies, cross-sectional studies, personal opinions, ethological study, ethopathological.
Again.
So like you are in the first two, na? Meta-analysis, RCTs. Then other that you have to arrange is cohort, case control. Then you have to arrange personal opinions, ethopathological study. Then the next one is uh, cross-sectional studies. Yes, these five.
Cross-sectional, and then population. Yeah, like ecological.
ठीक है.
Am I right?
Yes. You can ask from pharma.
Any antidepressant drug which is used for like to control smoking.
Antidepressant drug used to control smoking. Can you give me the options?
Smoking. Yeah. Sorry. Yeah.
It's like I have heard that.
Amitriptyline, varenicline.
Varenicline is the answer. It is
Which one?
smoking sensation में देते हैं. Varenicline is the answer.
Yeah.
Varenicline.
Yeah. Now my turn. Dharma.
What is the disease called when a person scratches their arms continuously as a psychological order and appear of multiple nail formation and red marks? It's in Dharma.
You demo.
Like
that word is not coming. Demographism. You're asking the term.
Like so let me just give you the options. First one is Nivai. Second is cat scratch disease. Third one is pyrosis. And fourth one is Bezor.
Bezor is ruled out. First one, what was the first one?
It. Yeah. Nivai. Nivai.
First one was Nivai. Second was cat
Cat
scratch
scratch
disease. The third one?
disease. Just to choose between first and second. I don't know. Third one, I forgot. Yes.
Are you asking about dermographism? You are asking, like the person is like.
It's a psychological disorder where a person constantly
Nivai?
feels the.
Nivai?
It's cat scratch disease.
What?
Cat scratch disease. So basically, in this disease, a person is continuously has psychological order where they have a feeling to scratch their arms, and which leads to the formation of nail like marks and small dots like structures on the skin, and rashes also sometimes.
So guys, right now the score is 2 for Dr. Soumya and 1 for Dr. Jia. Please select the subject, Dr. Jia.
Yeah.
Easier.
Macula densa is formed by cells in which part of nephron? Macula densa एक नेफ्रॉन के एक पार्ट में मिलता है ना, तो वो पार्ट कौन सा है नेफ्रॉन का?
Like you're asking PCT or DCT, ऐसा?
हाँ.
PCT? Sorry, DCT.
DCT.
DCT, yes. Yes.
Yeah.
Okay guys, तो अभी टाई हो गया, तो एक क्वेश्चन और पूछना पड़ेगा दोनों को ना, एक एक.
You can ask from या ऑब्सकैनी तो नहीं ना, ऑब्सकैनी पूछ पाओगे क्या?
Yes. So there is a female, she comes to an OPD and she has a EDD after 7 months as said by ultrasound. But as per her last menstrual cycle, the EDD is calculated, is shown to be 8 months, after 8 months.
She was
like you can also consider 6, like the patient comes to an OPD in first trimester as done by dating scan. The EDD is after 6 months from the present day, and as told by the LMP, it is after 7 months. There is a difference of 1 month. What's the reason?
I just know the 7-month EDD. I got
like what might be the reason? There is a contradiction between the EDD and LMP. Like
EDD and LMP में there's a contradiction.
No, by USG the EDD is shown after 6 months. By LMP it is showing after 7 months. So what might be the reason that the person is having 2 different EDDs? It's kind of one word answer. Like if I give you the options, it will answer will be there only.
LMP में लेट दिखा रहा है, EDD में पहले दिखा रहा है, ऐसा ना?
हाँ, LMP के थ्रू लेट आ रहा है, 1 महीने का डिफरेंस है.
I know it would be easy, but मुझे क्लिक नहीं हो रहा है, तो ऑप्शंस नहीं है इसके.
तो Dr. Jia, give her the options.
Okay, so one of the reasons can be the patient is not sure about her LMP date. It may be due to placental bleeding, or it may be due to just to give 2 options only then. There is a tumor in her body. There is ectopic pregnancy. Like first is the patient is not sure about her LMP. Second is
not sure of a date.
The answer is placental bleeding.
Placenta previa.
Placental bleeding. So placental
bleeding.
Huh. Like it's mentioned in Datta. So according to the placental bleeding term, what happens is that it happen a menstrual cycle की जगह after like 1 month of the LMP जब हम होता है, तो basically instead of they have very short periods which is considered as LMP only, but the amount of the flow is not much and it's basically due to placenta formation. So considering it as LMP, because the patient is saying right, a question में भी लिखा था specifically by calculating from LMP, so it cannot be that option also.
Okay,
so
she misinterpreted. Okay, got it.
Yeah, you can ask from gynae, I guess.
Okay, so do you know the morphological criteria of semen analysis? There's a percentage wise, no?
60% and 40%. 60%.
I'm asking the morphological criteria.
Like that out of the total sperm count, 60% should be mobile and 40% should have that particular shape.
अगर
Okay, so
नहीं हो रहा तो मैं
there's
तो
something
पूछ सकती हूँ.
vegitus. There's something vegitus uterinus. This is a
Yes.
previous year question. It is vegitus uterinus. What is this term refers to? I'll give you options also. Infections of vagina, infection of uterus, or cry of unborn baby.
What
Got
is
my
the term?
question?
Like, what is the
The
question
term
about
is
the
vegitus uterinus.
vegitus uterinus? And the options are the infection of vagina.
Options are infections of vagina, infection of uterus, cry of unborn baby.
Is it cry of unborn baby?
Yeah, true.
Okay, guys. So the winner is Dr. Jia, and she has a score of 3, and Dr. Soumya has a score of 2. So congratulations, Dr. Jia. Dr. Soumya, it was lovely having you here.
Thank you, ma'am. Congratulations, Jia.
Dr. Jia, we will connect with you shortly.
Yeah.
Congratulations, Dr. Jia, and all the best to Soumya.
Thank you, ma'am.
Yeah, Dr. Jia, I'll connect you soon. Thank you so much, both of you, ma'am.